Welcome to this Access Anatomy screencast from the University of Leeds that's going to outline the musculature and nerves of the posterior abdominal wall. So on the screen at the moment we can see the bony framework that forms the posterior abdominal wall. In the midline we have the vertebral column, we have the 12th thoracic vertebra, we have L1, L2, L3, L4, L5, and we have the sacrum. Radiating laterally away from the vertebral column at T12 is the 12th rib. We can also see the iliac bone here. We can see the inguinal ligament. We can see the femur, the pubic bone and the pubic symphysis in the midline here. Here's the pubic tubercle, which has the inguinal ligament attaching to it. This is the anterior superior iliac spine. So if we start by drawing the musculature onto the posterior abdominal wall, then we can start off with quadratus lumborum. This is a quadrangular shaped muscle that passes from the 12th rib superiorly down to the iliac crest of the iliac bone. So here we can see on this right hand side we have quadratus lumborum. Quadratus lumborum. And this muscle has the kidneys sitting on it. So we have a kidney on this side and a kidney on this side. We also have running laterally away from the posterior abdominal wall in this direction one of the muscle that runs round to the anterior abdominal wall, and this is the deepest of those three muscles. So here we have transversus abdominis. We can see the muscle fibers running in a transverse direction, and this is transversus abdominis. This will run around onto the anterior abdominal wall. So we can see transversus abdominis. We can also add on to this a muscle that's running from the T12, L1 and sometimes L2 lumbar vertebra, psoas major muscle, and that's going to be running down in this direction. And this muscle runs down, it enters into the pelvis and passes deep to the inguinal ligament to actually attach to the lesser trochanter of the femur. So here we can see this muscle here is known as psoas major. So here we can see psoas major. We can also see, although not actually in the pelvis, although not actually considered a muscle of the posterior abdominal wall as it resides within the pelvis, but this muscle coming away from the iliac bone. And this muscle also runs deep to the inguinal canal to attach to the lesser trochanter of the femur. And the reason I mention this muscle is that it comes from the iliac crest and it actually runs alongside and forms a common tendon with psoas major to form iliopsoas muscle that attaches to the lesser trochanter. So here we can see psoas major, here we can see iliacus muscle lining the medial surface of the iliac bone, and here we can see iliopsoas muscle. Converging, iliac muscle, psoas major muscle, converging towards the lesser trochanter of the femur. And here we have the muscles that form the posterior abdominal wall. Psoas major, quadratus lumborum, transverse abdominis passing transversely, iliacus within the pelvis uniting with psoas major to form iliopsoas muscle. We can also, on this left-hand side, include some important nerves, so radiating away from the 12th intervertebral foramen, so passing away at the level of the 12th thoracic, so leaving the spinal cord at the level of the 12th thoracic spinal cord segment, we have the subcostal nerve. So here we can see the subcostal nerve running inferior to the 12th rib. We have the subcostal nerve, and then we have the nerve leaving from the L1 segment. This nerve bifurcates into two nerves, the first one being the hypergastric, and the more inferior of the two, the ilioinguinal. And these nerves run around to innervate the groin area of the anterior abdominal wall. The subcostal nerve will pass around onto the anterior surface to supply the region of the skin just superior to the pubic symphysis. Remember, these nerves pass in between transverse abdominis and internal oblique muscle. So here in this short video, we've got the muscles and the nerves of the posterior abdominal wall.